Katie, I love your story that you've put in the chat. So Katie went to Colorado on a mission trip, made some best friends, and sent pictures and wrote letters back and forth for months. Um, and they're all still friends on Facebook. So that's wonderful. Thanks for sharing that. Brent, no pen pal, you missed out, didn't you? I
I
actually had
did.
do what?
Absolutely missed out on that one.
I had a pen pal from Japan. I think we got connected when I was in the sixth grade, and we wrote back and forth for years. I guess when we went to college, um, we stopped communicating. So had a pen pal in my Spanish class. Is that you, Heather? Yeah. You don't remember much about the process.
Yeah, I really don't remember the name or anything, but I just remember she wrote to me in English and I wrote to her in Spanish.
Oh,
And we were both practicing.
well, that's cool.
Mhm.
Looks like we've got a good group. Heather, Curtis, I don't know how many people are registered for today, but I think we're good to get started.
Yeah, I'm not sure either. We can go ahead and get started. All right. All right, everyone. Thank you for being here. Welcome. Oh, we got a couple more people joining, it looks like. But welcome. Today, my presentation is going to be about creating an evaluation plan, and it's a specific and tailored one. So if you're one of the 16 health departments who received the special funding for fiscal year 24, this presentation is specifically tailored to you. If that doesn't include you, that is okay. This may be a recap for you. You may learn some new things, and that would be great as well. So I'm going to share my PowerPoint slides here. Jackie, it looks like you're the one showing up in my box. Can you see my slides? Can you give me a thumbs up if you can see them? Cool, thank you. All right, so we can go ahead and get started. So this is going to be how to create an evaluation plan. Like I said, this presentation is specifically for those 16 local health departments that are receiving the special fiscal year 24 funding. Now, here at the state, our programs do a myriad of different things that fall under their prevention, promotion, and protection. Here at the tobacco program, we can fall under any of those three: keeping people from using tobacco and nicotine, protecting them from using secondhand smoke, and helping them quit are all ways that we can keep people healthier and our communities healthier. But in order to do all of those things properly, we have to know how to evaluate our programs. And the big question that I hope we can answer today is, what is program evaluation and what all goes into it? So program evaluation is ultimately a collection of information about the activities and outcomes of a program that allow for judgments of the program and then ultimately improvements of the program. Now, it's important to remember that all of this does not occur in a vacuum. These things are not mutually exclusive. They all affect each other and are definitely affected by things like time, resources, and political context. And ultimately, you should be used to make decisions about implementation and to improve effectiveness of your program. And it can also, whenever it comes to program evaluation, it can evaluate your entire program, every single thing that goes into it, but it can also evaluate smaller pieces. And whenever I say smaller pieces, it can be the processes that you take to enable that or implement that, the evaluation, or the evaluation of the outcomes, or even evaluation of the small parts that go into those things. But for the evaluation that I'm going to be presenting to you today, the evaluation plan for today, we're specifically focusing on evaluating 4 components: your resources, your activities, your outputs, and your short-term outcomes. Now, a couple of things I want you to keep in mind while I go through my presentation today is that this is a condensed evaluation process and that it will be specific to the 16 local health departments who were funded for the special fiscal year 24 funding. This process is meant to monitor and record data for your chosen activities and then to reflect on that data to inform your future decisions. And another thing I would like for you to keep in mind is that this evaluation plan is not a one-size-fits-all. It is not meant to be applied to just any program or even any other tobacco-related grant. It is specifically for this special funding period. Now, just before we get into the content, I want to go over some due dates for the plans and reports that'll be due for the grant. Don't worry about like furiously writing these down. This will be shared, and these due dates will be shared not just through this PowerPoint, but in emails afterward. So the first thing that will be due to us from the 16 health departments will be the evaluation plan. It will be due roughly 2 weeks from today on Friday, September 22nd. And that will include three things. That will include 3 completed SMART objectives, a completed logic model, and 5 baseline metrics. We've created a reporting tool that I will screen share with you at the end of this and that will be sent to you after this presentation is done. The next thing that will be due is on January 17th in 2024. And this is going to be your 6-month progress report. It's going to be an update to the 5 baseline metrics that you choose, as well as challenges and successes that you experience in the first 6 months of the grant cycle. And then finally, in summer of 2024, we haven't nailed down an exact date for that yet, but we'll let you know in due time. And that will be, for that, we will be asking for the final update to those metrics that you selected and the challenges and the successes that you experienced throughout the year. Now, without further ado, we can get into the content of the presentation. So at the beginning of any evaluation process, you want to have questions in mind that you would like for your evaluation to answer for your program. Here I've listed a few questions, or a few examples of questions you may want to answer for fiscal year 2024. Now, these are specifically short-term outcomes. We're not going to end as we move on. I'll make sure you understand why. But these are some questions for fiscal year 2024. It could be something to the effect of how many coalitions did we engage? How many medical providers have we educated about referrals? How many quitline callers did we have in our county or in our district? How many freedom from smoking classes did we offer in that time period? How many people completed not or in-depth classes? And those are just a few examples, and a couple more that you may consider are the number of students that were reached with a specific program, or the number of schools you implemented a program in, or even smaller policies that you could change. So if a school district replaces suspension with a cessation program. So after all of those questions are considered, you can begin the planning process for your evaluation. And like I mentioned earlier, this is a condensed version of the evaluation process, specifically due to the shortened time frame that we have for just the 1-year grant for fiscal year 24. So these are the 4 steps that I would like for you to follow. The first is engaging your stakeholders. The second is describing your program. The third is gathering credible evidence, and the fourth will be reporting your findings. These slides should help guide you through the reporting tool, which I'll share at the end. And I want to begin with the end in mind. So since this is a kind of a unique evaluation plan that we're asking you all to complete, I wanted to begin with the table that you guys will fill out at the end of the reporting tool. And I know you see some terms here that I've mentioned. So metric, in the reporting tool, we have a list of example metrics that you can choose from. Whenever we say metrics, we mean what will come from the outcomes of your evaluation. And whenever we ask for baseline data, that means the data that you will start with. So the baseline data will be from fiscal year 23, and that data you'll start with. And then for your 6-month update and your end of year grant, you can evaluate, was there an increase? Was there a decrease? Did it remain the same? And then for future purposes, you can evaluate and see, did that program work? Did that activity work? Was that implementation successful? Now to bring it all the way back to the beginning, step one is engaging your stakeholders. Stakeholders can be people or organizations that are invested, interested, or have a stake in the results of your evaluation. There can be a few of them, there can be a lot of them, and they can be involved in a lot of different ways. And whenever it comes to engaging stakeholders, it can be good to think outside the box and include people who don't agree with you or are maybe even critics of you or your program and what you're doing. Here I've assembled a short list of potential stakeholders, but it can always be more than the 4 or 5 that I've listed here. And if you ever come to a point where you're having trouble deciding who you would like to be a stakeholder, there are always questions you can ask yourself for additional guidance. A couple of them could be, do they increase the credibility of our program and our evaluation? Are they responsible for any of the implementation of any of our activities? And do they advocate for changes to our program for people who are in positions of influence? Additional stakeholders could possibly be business owners or healthcare systems professionals. Engaging your stakeholders is incredibly important. If you engage and have stakeholders who are committed to your program and your evaluation, the next 4 steps become a lot easier, and the next 3 steps become a lot easier. So the second step is describing your program. The goal of describing your program is to be clear and succinct, and you want it to clarify 3 things: the purpose of the program, the activities that you do, and the capacity that you have. And there are 2 reasons why you want to do that. Stakeholders must have all of the information that is available to them, and it enforces a strategic thinking environment. The initial description of your program is a big opportunity for the stakeholders to have a serious amount of input and to help shape the program in a way that is more in tune with your community. That's a big reason why you want to engage your stakeholders, is making sure that you have a community-driven program. Next are the 2 building blocks of describing any program. There are your goals and your objectives. And if these are clear, your logic model that we're going to ask you to fill out and write in the reporting tool that we've created should essentially write itself. So goals are the expression of the overall mission or purpose, and they will guide the full development of your program. And objectives are statements describing the results to be achieved and the way they will be achieved, ideally in SMART format. SMART objectives are the bedrock of any evaluation plan. And if your SMART objectives are written clearly, you'll be able to evaluate everything that you've chosen to do. So SMART objectives are, and SMART is an acronym. So the S meaning specific, and that indicates a specific event or location or action that will take place. M meaning measurable, indicating that a percent or total increase or decrease will take place. A meaning attainable, and that indicates something that can be achieved with the resources that have been allocated for your program. R meaning relevant, which will indicate that your SMART objective is logical and within the scope of your focus, time bound, and you may also see in other resources time oriented, meaning that it has a specific time that it will be achieved. And the SMART format allows for a clearly defined objective by doing three things. It sets your program's priorities, it aids in monitoring progress toward achieving goals, and it sets targets for your accountability. Here I've written a couple of example SMART objectives. So our first one, in example county, in example county indicates the specificity of your SMART objective. We will have a 15% increase in 1-800-QUIT NOW each year of the grant cycle by June 2024. June 2024 indicates that it is time oriented. 15% increase in calls indicates that your SMART objective is measurable. Each year indicates that your SMART objective is attainable because you can't collect something by year. And calls from 1-800-QUIT NOW are relevant to the program and the activities that you will be completing. And the data source for this objective could be the QuitLine dashboard that we send to you every month in the monthly memo. The second example that I created, an example district. This is an example of the specificity. We will meet with our administrators from all schools to assist in implementation or maintenance of 100% tobacco-free schools policies by June 2024. June 2024 being time-oriented again. 100% tobacco-free schools being the relevancy portion because 100% tobacco-free school policies are relevant to your program. Meeting with your administrators from all schools to assist is the measurable portion. The number of administrators you meet with and the number of schools that you go to is the measurable part. And implementing and maintaining those policies is attainable. And data sources for this could be the agendas that you set and create for these meetings, the minutes that are taken, and the attendance sheets for those meetings. We're asking you to create a logic model, like I mentioned earlier, for this evaluation plan. If you have not done one before, that is not going to be a problem at all. Here I've written out some definitions of each component, and in the next slide I'll provide examples, and I can also provide resources if you need further help understanding. So resources are what you need to implement your activities. Activities are what the program and staff do with the resources that you've been allocated. Your outputs are the tangible products, capacities, or deliverables that result from the activity. Excuse me. And outcomes are changes that occur in people or conditions because of your activities and your outputs. And there are three different types of outcomes. There are short-term, intermediate, and long-term. And as I mentioned earlier in the presentation, we are only asking you to set short-term outcomes for this grant cycle. We're not asking you for intermediate or long-term because of the nature of the timeline.
Curtis, I'm going to interrupt you for just a minute
Sure.
because there was a question in the chat about using 2021 KIP data, which kind of relates to those short-term and long-term goals.
Absolutely.
So it says, can we use the 2021 KIP, the latest survey data for our district?
And the answer to that is absolutely, because as of right now, I'm sure that that is the most recent data that some of you will probably have. I still use 2021 KIP data myself. If you somehow come across some county level or district level data that is from a survey that you used or were able to implement, that would be awesome. But if 2021 KIP data is the only thing that's available to you, that is just fine.
But that would be like a long-term outcome.
Correct.
Right?
Yeah. In the next couple of slides, we'll see that the most likely data that you'll use is programmatic data, because that's where you get most of your short-term outcomes from. Examples of logic model components I wanted to provide some examples just so you guys could see some while I was going through the presentation. A lot of these, I'm sure, will look very familiar to you. The idea of a logic model is to just streamline the information that you have, so you know what you're doing, how you're doing it, when you're doing it, and what can come out of it. And I won't read all of these, but funding sources could be a resource. Creating a communication plan could be a potential activity. A completed communication plan would be an output, and outcomes include increasing knowledge, attitudes, and awareness, or also the number of calls to the quit line in a 1 year period, excuse me. And this next slide is an example of a logic model that will be included in the reporting tool that I'll share with you at the end of the presentation. It will likely look different than ones that you've seen before because of the condensed nature of this evaluation plan. You can see that the intermediate and the long-term outcomes have been removed from the end of it. And that's just to remove any confusion so you don't have to worry about filling out the intermediate and long-term for this grant cycle. And I'll pause here for a few seconds so you can look at it. The next step after describing your program is gathering your creditable evidence. In your evidence, we want it to be trustworthy and relevant information for your stakeholders to answer any questions that they may have. Data can come from an existing pool, or you can acquire it yourself firsthand. And like I mentioned earlier, so you're going to have your baseline data likely from fiscal year 2023, or even prior if needed, and then after implementation, so for your 6-month update and your end of year update. And I put pre and post there to indicate possibly a pre survey that you may have conducted prior to fiscal year 2024, and then one that you complete during fiscal year 2024, for example. Your existing data any existing data could come from something like the BRFIS, which is the Behavioral Risk Factor Surveillance Survey, or Surveillance System, excuse me. The Youth Risk Behavior Survey, Chronic Disease Registries, Vital Statistics, National Youth Tobacco Survey, Kentucky Incentives for Prevention, or your own program records. And like Jackie indicated just a second ago, likely any of the metrics that you select and many of the examples, if not all of the examples that we include in the reporting tool, should come from your own program records. It's unlikely that any of the short-term outcomes that you select you will be able to get any data from KIPP, BRFIS, YRBS because of the short nature of this grant cycle. Next, I wanted to show a couple of ways that it may look like you're collecting evidence during this grant period. Monitoring the number of quit line calls through the monthly dashboard that we send out in our monthly memo. Observations of coordinators and educators during implementation of activities during your program cycle. Pre and post surveys during activities of the program that you're enacting, or monitoring social media posts for their engagement and impressions. And then we finally wrap all the way back to the end, which is reporting your findings. This is what will be used to convey the impact that your program activities had for the 6-month report and the end of year report. And just one more time to go over it. There's going to be a list of metrics that we have in the reporting tool for you to refer to and to choose and potentially choose from if you're having trouble finding some of your own. And those 5 will come from the outcomes that you have in your logic model. the baseline data will be from fiscal year 23 or prior to that. Your 6-month and end of year grant updates will be due on January 17th and then in the summer of 2024. And if you are interested in additional resources, please feel free to contact me. Because this is a condensed version of an evaluation plan, a lot of the resources that are available on a national website or on state websites include some steps and processes that you won't necessarily need to take. So if you need more information or additional resources, please feel free to reach out to me. I'd be happy to meet with you one-on-one and tailor any additional guidance that you need to your needs.
We have a question in the chat. It
Okay.
says the logic model would be explained very similar to how we filled out grant objectives, etc. Correct?
Yes. Yeah. And that's my final slide. I appreciate you all being here. I hope those 16 health departments that we've been able to especially fund this was helpful. And I'm happy to take some more questions. But so we'll leave a few minutes for questions, and then if there aren't any more questions, I will share the reporting tool and go through it a little bit.
Feel free to come off mute and ask your question or type it in the chat, whichever works
Absolutely.
best for you.
Can someone tell me if the latest newsletter for September has been sent out yet? I haven't gotten anything.
It has not. It's in the approvals queue, so it should it got sent out sometime, hopefully this week, but definitely by the end of next week.
Looks like we have a few questions in the chat. Yeah, Jordan, a copy of this will be shared with you. It will be. And Pam, exactly what's going to be doing the 22nd is going to be in the next document that I screen share after questions are asked.
We have this whole presentation recorded, so we will definitely get you a link to that too, to go back to and reference.
Okay, I'll go ahead and share the Word document now. Heather, can you give me a thumbs up if you can see it?
Make it a little bit bigger.
Yeah, I will zoom in.
I think that's good.
Cool. Alrighty. So this is the reporting tool and the evaluation plan template that we've created for those 16 health departments that will be filling this out. Initially, the information that you're going to want to fill out is the health department that you're working for, the name of the person who is submitting the evaluation plan, and the date that you're completing it. So that will either be prior to or on September 22nd. And it will be emailed to our program email at ky.tobaccofree@ky.gov. So the first part of the evaluation plan that we're going to ask you to complete are creating the 3 SMART objectives. The same examples that I provided in the presentation are provided in the evaluation plan. We're gonna ask you to create 3 of those. So there's a second, let you guys see. And once your SMART objectives are completed, we're going to ask you to fill out a logic model. The template for the logic model is here in the document. Here's the example logic model that I shared in the slides today, and the definitions of each component are in the document as well for you to refer to. And then finally, after you have completed your logic model, you can go to part 3, which are the metrics that you're going to choose to report to us for the 6-month or for the baseline data from fiscal year 23, the 6-month update, and the end of year final report. So you'll choose these 5 metrics that you will track. You're more than welcome to choose 5 and add rows to the table if you would like, but don't overwhelm or inundate yourself. And here are a list of the metric. Here are a list of some metrics. These are not the only metrics that you have to choose from. You're more than welcome to write your own, tailor them to the activities that you have set for yourself for this grant cycle. Please don't limit yourself to these. If we don't have any questions, I'll go ahead and stop sharing so we can have overall questions, not just for the Word document or the PowerPoint here at the end. It looks like Elizabeth Holbrook asked how the new reporting program is compared to Catalyst. We no longer use Catalyst for the 2-year grant cycle. We now use REDCap, but this is not in REDCap. This will be just this Word document and another one that follows it for the 6-month and end of year updates for the evaluation plan. There is no program that you'll have to worry about logging into. Not Catalyst. And Tammy, your program is already funded, so you won't have to worry about filling out this form. You will just continue to report as you do in REDCap with updates to this and what you're doing with the extra funding as well. Absolutely, no problem. stop sharing. I
Any
think
other
that's,
questions for Curtis? Oh, there we go.
um, yeah, actually, of course. So if you are funded for fiscal year 23 and fiscal year 24, and you were also funded for the special funding in fiscal year 24, you will report as normal in REDCap. You will just provide updates to what you've also done with the extra funding in REDCap. You do not have to complete this form. This is only for any programs who are not previously funded to fiscal year 24. Of course, no problem. Okay.
Curtis, when will we be emailing this out?
Today.
Cool.
So it looks like the questions have looks like the questions have slowed down. So oh yes, and okay, before we end, Emily Goodwin, our communications person, is going to put a Google link in the chat for the evaluation of this webinar. So please, before you leave, go ahead and give that a click. Let me know how I did so I can tailor my next evaluation plan presentations to everyone's needs. And before we wrap up, I just want to reiterate that if you feel like you need extra guidance after you have gone through the PowerPoint slides again and begin your evaluation plan, please do not hesitate to reach out to me. I'm happy to meet with you one-on-one. If you feel like you need it, I can tailor any guidance documents that I have available to me to you and your specific needs for your program. Oh, that's great news, Isaiah. Awesome. Yeah. So I think that's probably the end of the webinar. So if nobody has any more questions, we can go ahead and wrap it up and you guys can go ahead and get on with your day and be looking for the email for me to see the evaluation plan and these slides. No, thank you, Pam. I appreciate you all being here today. Thank you very much.